with our Taking Action for Your Health campaign, in this week 3, the focus is on pediatric medicine. Tonight at 5 p.m., Linda Hurtado has a special report on ear infections. On Friday, it's pediatric surgeries, how doctors and patients can prepare. And we started Pediatric Week with Linda's special report on sleep disorders involving kids. All these stories are being posted on our website and our Facebook pages. And as we do throughout the campaign, we bring in an expert to join us on Positively Tampa Bay to talk a little bit more in depth about these issues. Joining us today is nurse Terry Alm, who is of Pediatric Surgery Centers, the administrator. Thanks for coming in.
Sure.
The one thing I want to ask you about is, let's talk about surgeries. You said that during the summertime, that's when a lot of parents schedule these elective surgeries. What is the #1 concern that you all see?
The first concern we see, the parents have a loss of control. We take the kids, right from when the surgery is scheduled. It's something they've never experienced before, most of them. So they almost don't know what questions to ask. So therefore, that's why it's so foreign to them.
Right.
So they don't.
So what are the questions that parents should be asking of the surgeon, you said of the whole team? They really should know.
Right. There's, their biggest experience, they go generally from their pediatrician to the surgeon. So they know their surgeon. So they're more comfortable with that. But the back end, if you will, kind of as we say when they come either to us or for their care, is you have anesthesia team, the nurses that work with them right from the pre-op phone call all the way through to the last phone call they get a couple days after surgery. So they should ask about the team. What's the experience of the whole team? Is the anesthesiologist, does he only do pediatrics? Is the nurse in the room passionate about pediatrics, or does she just have to do pediatrics? In our world, I would, as a mom, want somebody that only does pediatrics and loves pediatrics and wants to care for their kid all the time.
How are things different in terms of, how the medicine or the anesthesia is administered to how that nurse in the recovery room is talking to the child?
Right. Everything in peds is size related. So you have to have available from 2 months old in our world all the way up to 18 years old. So you want to be comfortable as a mom knowing they have the exact size of everything. So we have to, from the tubes, so to speak, different things that we use, has to be pediatric size. The anesthesiologist has to recognize how to treat say patient number 1 today is 2 kilograms to patient number 10 is 15 kilograms. There's a big difference in how you're going to take care of them and everybody in between. So how does he titrate everything? How do they know how to do that? How does a nurse take a 2-month-old in her arms and then be able to also calm a 5-year-old? We have to have all that expertise and the emergency training that goes if something doesn't go as planned.
And you were saying earlier that you also have 2 patients. You have
Right.
the parents and you have the kids, and we'll continue this conversation on Facebook. We've got a lot more information with Terry Alm, so come on back on Facebook. Also, if you'd like to learn more about the Pediatric Surgery Center, they have 2 locations, Hillsborough and Pasco County. The website for them is surgerycenterforkids.com. In Hillsborough, the number is 813-490-6100. And in Pasco, it is 813-343-5690. Thanks for watching, everybody.